Hello, everybody. This is Dr. Hamid Elmiar. I am the host of the podcast with Dr. E. At this podcast, I sit with the world's experts in health, education, and community development to talk about current health challenges and ask them to share their experiences, knowledge, and thoughts with all nations across the world, especially the developing countries, so that we learn from experts across the globe. I have an amazing guest today who is a public health expert and a Fulbright scholar. It's a pleasure to introduce Felix Holl. Welcome to the show.
Thank you for having me. That's a great opportunity to participate in this. Thank you.
It's a pleasure. Felix is a PhD candidate in medical informatics at the University of Munich in Germany. After his undergraduate training in medical informatics in Germany, Felix got a master's in global health sciences from the University of California, San Francisco as a Fulbright scholar. Prior to starting his PhD, Felix worked at UCSF as a health informatics specialist and developed surveillance IT systems for infectious diseases with regular field work in Southern Africa. Felix is currently conducting research on mHealth applications. He is also trained as an EMT, emergency medical technician, with the German Red Cross and works as volunteer EMT in the emergency medical services and is a delegate for the Red Cross International Disaster Response. Welcome again, Felix.
Thank you.
So we're going to start today's conversation with Felix to talk about the current situation, coronavirus in Germany. And starting the very first question, Felix, many people think Germany has a stable healthcare system. What do you think?
Yeah, I would very much agree with that statement. There's always a couple of different metrics and rankings of how to determine which country has the strongest healthcare system. Sometimes France comes out first, sometimes the Netherlands, sometimes Germany, but I think overall we're definitely up there. So we do have a very strong and stable healthcare system. And what I mean with strong and stable is not just that it might deliver the best care possible, which for example the United States has probably the healthcare system that would be able to deliver by far the best care, but it also is affordable and accessible to everyone in Germany. So what that means is that for a long period of time, all Germans had the right to health insurance, and now they actually have the duty to have health insurance. So what that means is you have to have health insurance. For most people, that comes with their job, so they're automatically enrolled in the social health insurance scheme. But there is a small portion, about 10% of Germans are in a public health insurance scheme, but they have the duty to actually be enrolled in one of the two. So that basically means that like all German citizens have access to healthcare, which is important for this crisis because they're in other places where they might have to pay for it out of pocket. There's obviously a huge barrier to seek both testing and care if you feel sick or if you suspect to have coronavirus. So in Germany, there's no co-payments for either testing or treatment. So I think that's a huge important factor for people to just seek care when they're sick or to get tested when they think they might have contained the virus. Additionally, we do have a very high number of ICU beds per capita in comparison to basically all the other European countries around us, especially France and Italy, who had that high number of cases. We do have a huge number of ICU beds, and we're actually able to increase that number quite significantly over the last weeks and months, even though we actually didn't end up needing them. But if we had had a bigger outbreak, we also hopefully would have been able to cope with it a little better. I guess the other big thing in terms of testing it that we have a very decentralized lab infrastructure. So other countries might have like centralized large labs. In Germany, there's both a lot of hospitals have their own small lab, and there's this decentralized network of small private labs all over the country. So that just means that Germany had a very, very large lab capacity from the beginning of that pandemic. And I think that's also kind of like one of the main factors that contributed to Germany controlling COVID that fast is that we had probably the highest rate of testing after, I think, Korea.
Right.
That's important. And also one of the first reference tests by the WHO was actually developed in Berlin at the Charité. I think these are factors contributing to it. And then I guess on the downside is that a lot of smaller hospitals in rural areas have closed in recent years. So even though we had like a high number of beds in addition to the ICU beds, that has been reduced quite a bit in the last years. But they're actually able to reopen a couple of those hospitals who just closed in a within the last year or two. So they were also able to just increase the bed capacity quite quickly. And then I guess the last thing is because we, at least in certain parts, still have very large number of hospitals, they're
Hmm.
actually able to kind of differentiate between having COVID specific hospitals. So in a
Hmm.
county, if there's a couple of hospitals, they decided that one hospital we be the one to take care of COVID patients, while at least one other hospital could be used for non-COVID patients. So that was a way to very greatly separate the two and kind of like prevent contamination.
Hmm. Well, thank you for the very comprehensive discussion and talking about the health system in Germany. And you pointed to a very key point there. You said that the health is not only right, but you stepped it up a little bit more in saying that it is a duty for the government to provide healthcare for people, which is amazing. And so, just following up with this pretty much along the same line, the other question that a lot of people um, are actually asking. Germany's been quite successful in containing coronavirus as opposed to other European countries with pretty much similar health systems. What measures actually did Germany take in order to control coronavirus? You pointed to a few, but would you like to give us a little more detail?
Definitely, yeah. I'm probably just going to reiterate a little bit and then just go into more detail. And I think the most important one is that Germany started early on testing at a very, very high rate. So if you look at the numbers of tests that were conducted, that's probably the thing that kind of like set us apart from many other countries.
Hmm.
So initially they had reference tests at the large university hospitals very early on, but then tried to expand it very quickly. So a lot of the local health departments were able to send people to testing sites. So they initially started to set up small testing sites within hospitals, but then actually expanded and set up separate like drive-in testing sites at like a convention site or something like that, where they would just staff it 20, like at least 8 hours a day with a physician and like a nurse and maybe a paramedic or a Red Cross volunteer in most cases actually. So
Hmm.
people would call the health department and say, well, I might have corona. I had contact with a suspected case. They would then get an appointment, a time slot where they would literally just drive to that testing station, wouldn't even leave the car. Someone would just do the nasal swab and then they would get the
Like
result.
drive-throughs,
Sorry?
like drive-throughs through the
Pretty
drive-throughs
much,
in the
yeah.
park.
That's what they intended it. So the contamination would be minimalized as much as possible. Yeah. And then initially it would take about 4 days to get the results, but then they boosted testing capacity quite a bit and you would get the result within a day often. And then like small scale software companies started to develop apps that instead of the health department having to call you, you might just get a notification on your phone saying, hey, your result is ready. You're positive, so you have to stay in quarantine, or thank God you're negative, and you can kind of go on with your life.
Mhm.
And then I guess what we did from the recent reports a little later than we should have, but we're still quite successful, was just to introduce shelter in place and social distancing measures. So they were introduced in a very direct way. So people were prohibited. Initially, it was like that not more than two people were allowed to be in the same place outside.
Right.
Um, and so not like in other countries like in Greece where you would have to seek approval from the government or the local health authority to leave your house. People were still allowed to leave the house.
Hmm.
Um, but a lot of activities were prohibited. So like all the health clubs were closed, all the restaurants, all the bars. The restaurants, for example, were still able to offer takeout, but with certain distance measures around it. But people were still allowed to exercise at every time of the day. So running and cycling, for example.
Hmm.
And then they slowly started to kind of wean off those mechanisms, but only after the number of cases dropped significantly. But for example, now there's reports that we should have actually introduced those measures a little earlier because the first wave of infections actually happened during the carnival in Germany. So
Hmm.
the contact tracing revealed that it was like one carnival event where there were like 200 people in a room, and quite a few of them actually got sick. So if we had started earlier, we might have even had a lower number of cases. And aside, I guess, from the testing and the social distancing, the German healthcare system was boosted quite a bit. So as I said earlier, they try to reactivate decommissioned hospitals by just trying to restaff them, but they also set up a lot of temporary hospitals. So for example, Berlin, they converted the large proportion of the convention center into
Mhm.
a temporary hospital, and they did that all over the country, basically trying to like identify structures that are suitable to be built into a makeshift hospital. And actually, I don't think we had to use any of them, but they are there in case there's a re-emergence of the disease.
Mhm.
And the other thing they did was trying to increase ventilator capacities quite a bit. So within existing hospitals, a lot of the hospitals were able to double their ICU bed capacity by purchasing ventilators on the market, by getting them from the military that had them in stock, and using the
Right.
disaster response units ventilators. So a lot of the hospitals have a lot of over ICU capacity that we didn't have to utilize, but looking at the numbers of people on ventilators, both in
Mhm.
France and in Italy, that was kind of what was necessary to
Yeah.
prepare for a resurgence of cases. And then I think another country that's really interesting to mention in this context is actually Greece. I don't know if it made it to the news outside of Europe, but Greece kind of knew that their healthcare system wasn't as strong as, for example, the German healthcare system, because they were in an economic crisis for many years and had to cut government spending. So
Yeah. Yeah.
knowing that the healthcare system wouldn't be able to cope with such an influx of cases, they actually introduced much stronger quarantine measures. So people were not allowed to leave the house without prior approval from the government. So there was a texting service in place where you would send a text message to your health authority saying, I need to go out grocery shopping. And then you would get approval with a time slot that allowed you to leave the country. And they actually had a much lower number of cases because of those strong measures. So I think that's something where even Germany could have learned from other countries. But
Mhm.
I guess we just didn't have to be that rigorous because, at least for the current number of cases, we were able to deal with them.
Perfect. Great. So you mentioned about the Germany boosted the healthcare system. I think it is for some countries like Germany, it was a little helpful because to learn from other countries as it started in China and then spread in Europe and some other countries across the world. Unfortunately, it's almost all over the world now. But so the advantage of that, people can learn from the countries that they have been through the same process, and that's why we are trying to talk to each other from across the world to learn from the experiences. And the main purpose for this podcast is the same thing, to bring people from across the world on around the same table, and virtually now because of the coronavirus. And we're talking about this to learn from our from each other's experiences. So that is do you think that that will help? This is just to follow up with the question that I had is, you said that the Germany, actually Germany boosted the health system. So do you think that that also helped learning from other experiences like in Europe and in Italy, I guess?
Yeah, very much so. So, for example, the Federal Ministry of Health sent teams both to
Mhm.
Italy and France to kind of assess the situation. So there was a very devastating report from like the border region of France to Germany, where they saw that people over 80 just wouldn't be put on a ventilator because they knew they were reaching
Yeah,
like
which was sad. Yeah.
that was like one of the main takeaways, knowing that if there was that high number of cases, we would need a much larger capacity for ventilators. And knowing how long people would stay on a vent, they
Mm.
just did the math and figured out that by far we didn't have enough capacity. So they both tried to limit the number of cases by introducing those very strict quarantine measures and social distancing measures, but also tried to boost the healthcare system capacity. And it's not just setting up beds and ventilators, it also meant figuring out how to staff those additional beds.
Exactly.
They
That's a
both
very
had
important
campaigns to like
part.
get
Yeah.
nurses and physicians that are not in the healthcare sector anymore to come back. So both like recently retired people or people in academia or in research or just someone who switched careers. So they tried to both get those people back. They kind of like activated the disaster response units, kind of like
Mhm.
try to see what staff capacities are in volunteer structures and instructed like simple first aiders or EMTs, and means to basically provides basic care to patients in case they were needed to staff both those additional beds and, for example, to staff those hospitals. And I guess the last thing is that we initially we had a lot of testing, but we also realized that we wouldn't have enough testing capacities to reach the number of tests needed to kind of get a good understanding of the number of cases. So to try to not have too many undetected infections. So that's the last thing, like the last pillar, and the measures we took was to massively increase lab capacities, which I think is still one of the success factors, what
Yeah.
contributed to us having that low number of infections.
I totally agree with you in terms of, the maximizing the number of testings. And I think that the more the testing you do, the more you know who, how many people are infected, so that you can isolate them and, contact tracing and stuff. And the US has been successful too in terms of increasing the number now, and the number of testings, as well as, during the pandemic, takeouts, like as you just mentioned, for restaurants and places like that still was open, which is really helpful for people, because we cannot stop totally the day-to-day life, and we need certain things like food and stuff for survival. So it's pretty much similar to the most part of the world. And I think it's some good news coming from Germany. I've been following the news. I've been reading about, since talking about the podcast and inviting people from across the world. I'm trying to read and watch the news and everything about different countries. There are some good news coming from Germany that I want to pose this question to you, that now that the businesses are being reopened in Germany, which businesses are already open, and what does the time frame look like for larger social events such as the soccer to get back to normal?
Yeah, totally. So as you've mentioned, that we have been quite successful with implementing those measures, but like pretty much from the start, they put a very big strain on both the economy and also personal lives of people. So initially, like all the manufacturing, most of that was just shut off right away. So like all the big car companies kind of stopped production and are now slowly ramping up production, but also demand has obviously dropped quite a bit. But the things that were shut down completely was all the sporting events, all the gyms, restaurants, at least all the sit-in places, and all the beer gardens were closed, all the bars. And now that people see that there are less cases, obviously the pressure on the government increased to figure out a plan how to reopen those things. So, for example, grocery stores always stayed open, but for example, department stores were closed and clothing stores, and then obviously those owners tried to push the government to reopen. So we're in a phase where the number of new infections is still pretty low, but we do see a small surge because of those reopenings. So initially they said that all the shops with like less than 800 square meters would be allowed to reopen, but with strict distancing measures. So they limited the number of people that were allowed in a shop. People had to wear a face mask, and like a lot of consultancy services were reduced. And starting last week, for example, restaurants opened up again in most states. So in
That's
Germany,
exciting.
it varies a little bit between states, because we do have a federal government and state governments, and these kind of measures are within the power of states, but they all have kind of like the similar lines. So last week, restaurants opened up. For example, what's important for Bavaria is that the beer gardens opened up again. So that's a big part of German culture in spring and summer, is to sit in a beer garden with friends and have a cold beverage outside. So these places have opened up again, but with obviously a lot less numbers of guests in those places. So there's only you're only allowed to be there with one other household. So if I go there with my partner, we can only meet up with one other household. So for example, another couple or one friend. So we can't meet up with a lot of different friends. And between the tables, there's always 1.5 meter distance. And for example, if I go to the bathroom, I have to put on a face mask. The waiters will wear a face mask in certain places. They will also wear gloves. And what's most important, I think, is that when you sit down at a table, you have to give them your contact details. So they have a sheet of paper with your contact details on it, then they will take note of the table you were seated at and also the date and time you were there. So if someone tests positive and notifies the restaurant that they are corona positive and they were happen to be sitting right next to me, the restaurant will then call me and say, well, you might have had contact with someone and you have to isolate yourself for 2 weeks. So that happened last week, but we actually unfortunately already saw the first kind of like small outbreaks because of it. So in one restaurant, about 10 people got infected. So it is a slippery slope, and you have to decide between kind of like reopening up life versus just trying to prevent the spread of the pandemic. For example, also places of worship have opened up again. So in churches and mosques, they have strict rules. It also means that people have to keep a distance of 1.5 meters between each other, and that you aren't allowed to have like contact. But we can't really ensure that it's always a bait, because, for example, in Frankfurt, in a church, there was an outbreak when about 100 people who attended one prayer session got infected. So it is a very, very delicate and fine line to find that balance. And for example, next week, hotels are going to open up again for private travels. So some hotels always stayed open for like a mechanic who would be on a business trip, a long-term deployment somewhere. But starting next week, both campgrounds and hotels will open up again. So that's going to be quite interesting to see how they will cope with those quarantine or those social distancing measures, and how that is going to affect the number of new cases. And schools have slowly opened up already. So they started with those who are supposed to graduate this year. So those tend to be the older high school students, for example, who at least hopefully fully understand the magnitude of this pandemic. So they also, again, have those quarantine measures where people have to keep 1.5 meters distance, where they would have to wear a face mask if they're in the hallway, for example. And now they're debating how to reopen up, like for all classes, but also how to open up kindergartens and daycare centers, which will be a lot more challenging, obviously, because you can't tell a 2-year-old that he's not allowed to play with his friend. So that's going to be interesting. And then I guess the most interesting new development is actually that the German soccer league had started their
I heard they were putting like their jerseys or portraits in the stadium.
Exactly. So basically the stadiums are closed for the public. It's literally just 22 players on the field and like all the support staff around it. But the players have to be in quarantine before a game for a week. Just to try to make sure they are not infected, and they do a lot of testing. So it kind of raises an ethical question of if it's okay to spend that much testing capacity on soccer players rather than medical staff, for example. But they always argue they have the money to pay for it, so I think that's okay. But yeah, as you said, they try to put jerseys over the seats because the stadiums are pretty much empty. So you can watch it on TV, but it's just a totally different feeling. And they started with the first German soccer league. And they also have started the second league, and I just heard on the radio before we talked that the third German league is also going to start up.
Oh, that's exciting.
Yeah, that basically means that it's like the first major European sports league to restart. But for now, it's literally just soccer, because a lot of other sporting events that are only funded by the people actually paying for a ticket to go there, it doesn't make any sense for them to start. But at least soccer has started, and I think it kind of helps a lot of people to go back to like a kind of regular life, because for a lot of Germans it's either going to the stadium, which is unfortunately not possible, but for others it's just to watch the games on TV with some friends, and if you obey those social distancing rules you can still do that. So I think that's an important step in the right direction, but we will have to see how that's going to play out in the long run.
Well, thank you again for this informative discussion. And you pretty much answered part of the my follow-up question that I was trying to ask about the challenges that Germany would see. What would be the biggest challenges? And I think you pointed to an interesting part there in reopening the restaurants and people sitting there, and they have to write down their contacts, their names, and kind of like identification, just in case if something if there's a positive case, then they can do the contact tracing. That's pretty much the reason for that, as I think. That is an interesting point, and there are like different measures across the world people are taking. I've seen pictures on the news from different countries that they have like those um, some kind of like a wall between the two tables so that people can sit, on separate from each other.
Yeah.
They're on different ways. Some people. Do you think it is like, just a follow up question on this specific point, that it is really, it is, people are not used to this, writing their names and contact when going to a restaurant. That is a challenge. What do you think, like people's reaction to that thing, and how big of a challenge would that be, and how long would it take for Germany to do so?
Definitely, yeah. So for me, when I first went to a restaurant, it was a weird feeling, but it took me like, oh yeah, it's for contractors. It makes sense.
Yeah.
And then you listen to the waiter who has to explain it to every person who comes to the restaurant.
Hmm.
I think people are kind of okay with it, especially because right now it's all paper-based. So you literally just
Yeah,
write it on a sheet of paper, and the restaurant will just throw it away. So it's not all going to one big database where they can just
I see.
build a map of the places that I went to. So I
Hmm.
think if they did a kind of a pretty good job of communicating to people why it is necessary to do so. Um, but overall, we have started to see like quite a bit of protests happening in towns and cities where
Hmm.
people protest against the strict social distancing measures because the number of cases is so low. So they don't really think about it as much anymore, that people are actually dying of it. So it's like
Hmm.
if you see the pictures from France and Italy, then you
Yeah.
know that it's a
Hmm.
serious issue. But now if you kind of like live in your bubble in your little town and there's no COVID cases, or maybe only a small number, and that is going down quite rapidly, but you're not allowed to go to the bar, you're not allowed to practice your daily life, people start to get frustrated with it. And the
Hmm.
unfortunate thing is that actually a lot of the right wing and like kind of like really bad people started to pick up on that trend and have now written that train and try to influence people. But the vast majority of Germans is still like very much behind it, because there was a decent amount of like information campaigns by like very reputable sources
Yeah.
that have done a good job. But for example, like the German CDC equivalent, the RKI, they had to obviously, which is part of a pandemic situation like that, had to correct their numbers and even sometimes correct their measures a little bit. So people got frustrated and saying, well, if they don't even know what they're doing, like how is this supposed to be the correct numbers? But I think that's just because it's such a dynamic situation. We have to change and adapt. But I think overall, the kind of like the mood in the general public is still very positive, and people do see the necessity. But
Hmm.
it is putting a strain on the economy quite a bit. So
Yeah.
a lot of people are only working 50% right now. So there is a measure in Germany in place that if a company does not have enough work to do, they can send their employees home for example, 50% of their time, and the government will actually pay for part of the salary.
Hmm.
So that mechanism has worked quite well, and it has been taken up by a lot of companies.
Yeah.
Um, the people still do get, like in most cases they will get 80% of their salary, even though they might only work 2 days a week. But in the long term, that's still less money than 100% pay, and you sit at home. And obviously, like a lot of self-employed people or artists or bar owners didn't have any income, so there was like a lump sum payment that you could apply
Right.
for. So they would get like 1,500 euros as a lump sum from the government, but it only covers a fraction of your costs. So people do get frustrated, and that might probably be the most problematic thing in the long run. So because the
Hmm.
goal is to keep the number of cases very low, people just don't see the problem anymore. So that might be the problem, that we might see a reoccurrence, but because also people might stop to fully comply with all the social distancing, might just meet up with friends. In the case the virus might just spread quicker again. But we'll see. We'll just have to wait and see and try to obey the rules.
Hmm. Thank you again. It's really important to know like what other countries are doing in terms of, we're trying to learn from each other. Obviously, the socioeconomic impacts and implications of the coronavirus has been huge in the Western countries, as well as in underserved communities and countries across the world. I wouldn't like, I would say that everyone, I mean, people get frustrated in getting back to work, back to normal. that I wouldn't blame people for that either. But I think, meanwhile, it is a little tough, that all the, the efforts that the people and the countries put together to contain the coronavirus, and you are flattening the curve. But it is tough. It's not easy. It would be very frustrating if it goes back to square one because of people not taking it serious. So it's a very delicate part there. Like, people have to understand all the implications of such things. I think that countries like, the rest of the European and the US can learn also from the rest of the world, especially when in the process of reopening. That partly, the reopening process is being started in parts of the US as well. However, in the East Coast, it's still, the lockdown, but it's just the parks that are opened and people can go there and walk, but they have to have the mask and they have to keep the social distancing. As you mentioned about the worship places also here in the US, the government announced that they can open, but they have to keep the social distancing. That there's a lot actually to learn from each other in this time, and this leads me to the final question that I always ask from the speakers and the guests, to talk about their experiences and how, I'm going to connect this to Afghanistan. How do you think, because this is a really difficult question, maybe because of the health settings is different in developing world than the countries like Germany. But how can Afghanistan learn from countries, Germany's experience and model of COVID-19 pandemic, as two countries are of different health settings?
Yeah, totally. That is obviously the main question that everyone is trying to figure out. How can we learn from those countries that are very successful? Because in Germany, for example, we always looked at Sweden, who would always propaganda itself as a country who didn't have a lot of social distance measures in place, that they still had a very low number of cases. But that's because, for example, their population structure is very different. So I think if we look at what Germany did and what Afghanistan can learn from it, I think the first thing is that the testing capacity has to be as large as possible in any measure. And it both means that there is enough machines and staff to actually perform the tests, but also the access to a test should be free, ideally. Because in Germany, as I said, there's no copay to get tested.
Mm-hmm.
And it is expensive. So even if a government or a country will just provide testing for free, I think that's money well spent to say, well, everyone who is potentially infected because they either have the symptoms that correspond with it or they had contact with someone who is positive, testing them and making sure to know that, to figure out their status, that is very important. I think it's also, in addition to the testing, to do the contact tracing is very important. That
Right.
can be done mostly with manpower, so you don't need a huge sum of money. You just need to have a lot of staff actually following up on those who tested positive, trying to figure out where they got infected, and then making sure to keep track of who they had contact with, and either tell those people to just self quarantine, which is basically free, or
Mm-hmm.
to test those people as well. So I think that might be the main thing that you could learn from Germany. The other thing is obviously to enforce the social distancing. I think
Right.
that is very difficult depending on the cultural setting. I know, for example, at the end of Ramadan in Germany, Muslims were struggling very
Yeah.
much
Yeah.
to keep that social distancing. So what they did is they had shifts in the mosque, so they didn't have one big prayer service, but they had a couple in a series, so that there were only a smaller number of people in the mosque for the prayer, with keeping the distance to each other, and then they weren't able to just visit their relatives and hug and kiss and eat together. And I
Mhm.
saw it on TV. They literally just were able to like go to your friends and family's house, leave the food at the doorstep, just wave at each other, and then you leave. So I think it just takes a lot of effort to actually obey to those social distancing
Right.
measures, but that is what is needed. And then I guess as much as possible increase hospital capacities. So try to set up makeshift hospitals, try to have ventilators, but that's obviously going to be a very costly, and especially now with the global medical supplies market being that crazy, it's probably just unaffordable to a lot of countries. That's the same with PPE. Even Germany was struggling to purchase PPE, so just masks and gowns and gloves for the healthcare staff. So I can only imagine how that's going to play out for countries with a lot smaller budget. Because even for Germany, it sometimes happened that other governments would literally just buy the supplies off the runway from a wholesaler and just take it to their country by offering double the money for it. So there are a lot of factors that will make it very difficult for low and middle income countries to cope with it. But I think there's at least a couple of measures they can take that are implementable and are feasible for these settings. And I guess just ask for help, because I think a lot of the high income countries have realized that it's going to be a global problem, and in order to control it, it needs a global effort. So hopefully,
Right.
like German medical centers who have spent a lot of money on testing can hopefully help, for example, with testing capacity. So it might even work to ship samples around the world and test them in a place that has a lot of testing capacity, for example.
Well, great. Thank you. Yes, I think it is different settings, like, countries being socioeconomically with some different challenges, like Afghanistan is almost totally relying on the international community to support in terms of fighting this COVID-19, not only fighting COVID-19, but in general. I think with the international support, if international communities and WHO and can provide more testings for people, as you mentioned, that is a key important part that is playing role in containing the coronavirus. Also, you mentioned about social distancing and other, the people can take part too, which necessarily doesn't need any kind of like equipment. But I think it is very important. I think I agree. I mean, I agree with you in terms of the manpower. If people can start also volunteering and helping each other, even raising awareness is really important, because it is like a crisis time. It is a crisis, and in the crisis time, like you raise awareness, you set goals, and then you take actions. I think for the developing world, such as Afghanistan, where we don't have all the other tools, but it is very important to raise awareness, and especially this time that we are recording this this podcast. It's Eid time there in Afghanistan, as you mentioned, also in Ramadan in Germany. So people are trying to normally, like, they go to each other's houses, relatives' houses, and they see, and as you said, like, they're hugging and kissing each other and having, sharing fruits and everything. But that's something that people are not doing that right now. And I would really encourage people not to do so, for at least for this year. Hopefully, we'll get rid of the coronavirus, or find the medications and the vaccine, so we can be better off the years to come, even if the coronavirus exists. So you talked about the challenges of the implications of the pretty much about the socioeconomics implications of the coronavirus in Germany. I think. Do you want to add to something in that regard?
Yeah, so basically, even though the German government has a lot of money to spend because we had like a very prosperous economy over the last years, and I mean a lot of tax money coming in, now that government has to spend a lot of money on both paying for those people who don't work full time right now, it's paying for additional hospital beds and all that. So it's both the amount of tax money that's going to flow in this year has decreased a lot, and the spending has exploded over the last weeks. So but it has put a huge strain on the government in terms of just their budget. I think that's maybe the first implication that's really, really important to think of. So right now it's that debate, how much money can we spend right now to try to not prevent the economy from collapsing versus getting bankrupt. I guess overall, it's just, as I said earlier, like a lot of the big car manufacturers literally had to halt production for weeks. So that is a lot of jobs associated with that. So people and companies didn't earn any money in that time period. So overall, those social distancing mechanisms have put a huge strain on the German economy. But I think
Right.
that's the right way to do it, because if hundreds and thousands and tens of thousands of people die of coronavirus, that puts even a bigger strain on the economy.
Mhm.
Um, but that also means that, like, for example, conspiracy theories and fake news have emerged quite a bit. So, because as I said earlier, the people don't necessarily see coronavirus that much right now, because the number of cases is that low. A lot of conspiracy theories have evolved, and more people try to publicize those. So it's either people blame Bill Gates because he's a huge advocate for global health. Everyone who works in global health knows that the work he's doing has been amazing. And he has actually invested, but not his own money, but the money from his foundation, into German companies that are working on vaccine development. So the first conspiracy is that it's all Bill Gates, or people will say that it's all big pharma, or people will say that it's the government just making that up. Um, so these are all factors that come together.
Yeah.
But I think the impact on the social economy will be devastating, but it will be manageable because, for example, people have not that many people have lost their jobs right now because of those government support systems and other social security schemes that are in place to prevent that from happening. But we'll just have to see for how long that's going to continue, and then we'll be able to judge what the economy is going to look like next year.
Mhm. Well, great, thank you. Yeah, it is hard when people don't see things like, this is an invisible enemy, and most of the microorganisms. Of course, it's hard to see it with your naked eyes, but as health professionals, we believe that it is in there. It's
Exactly.
it's there, so people have to be cautious, um, uh, regardless of the source and how it erupted and started. But it is a threat to the world, so people have to take it serious. Keeping the social distancing as well as fighting and the COVID-19 across the world and learning from one another. We are almost to the end of this podcast. For the sake of time, is there anything that I didn't cover and you wanted to mention, or about your work, about yourself, about what you do, or anything?
I mean, I think we covered literally everything that is there to cover. Personally, I think it's really interesting to see that people do care about surveillance systems and like predictive models a lot right now, because I've done that work for quite a few years on malaria, but in like
Mhm.
high income settings, no one really cares about the infectious diseases that much anymore. So now seeing that there is a push for like contact tracing apps on your phone, and that they're revamping surveillance IT systems and trying to like build predictive models and all that kind of stuff. It's really interesting to see what can be done with health IT for such a problem. And there is a big push to like set up a global pandemic warning system, which actually people like Bill Gates or the WHO have advocated for years, but never got funding for it. And now I think we can see a lot of those developments will happen. And I think if the next pandemic will make its way around it, I hope that we are much better prepared for it because we have those tools ready and handy and can
Yeah.
actually act a lot quicker. Because as I said earlier, if Germany had realized that they should have locked down a little bit faster, they would have had an even lower number of cases, and things might already look a lot different right now. So I
Yeah.
think that's, at least from my work perspective, that's quite interesting to see.
Well, thank you so much again, Felix, for your time in being on this podcast. It really is helpful for us all across the world, especially the developing world, to learn from experiences of other countries. And dear listeners, thank you so much for listening. And follow up the podcast with Dr. E and learn more about what's going on in the world, especially in terms of this pandemic, as well as the current situations in health and education. So thank you again very much,
Thank
and
you
have
very
a
much.
great day.
That was great. Thank you.